Okay, I have no affiliations to disclose. Hi everyone, my name is Sidra Matha. I'm a third-year medical student at the University of Leicester. The topic I'll be presenting on today is symptoms, impact, and coping strategies among women with overactive bladder. And I did research for this topic for my integrated BSc degree this past year, and I feel extremely privileged to have the opportunity to present my work at ICS this year. So we all know that OAB is a symptom syndrome suggestive of lower urinary tract dysfunction. And the definition of OAB, as is given by the ICS standardization report, implies that urinary urgency is the cardinal symptom of the syndrome. However, the definition is based exclusively on expert opinion and really starts to get us thinking as to why is it that urgency is regarded the cardinal symptom of the syndrome. There is also limited literature that has explored patient perceptions of symptom bother, impact, and the wider issues with the OAB syndrome. So our study is a qualitative focus group study, and we really want to capture the experience of patients with a range of symptom severity, and this is reflected in our recruitment strategy. So we recruited patients from the RELAX trial, from Urogyne clinics across UHL, and community continence clinics across Leicester and Leicestershire. Our primary method of data collection was focus groups, but we also aim to get some quantitative data in the form of the SPC and the VAS. So the symptom bother chart helped us to gauge patient perceptions of symptom bother, and the VAS helped us to gauge patient perceptions of symptom impact. The qualitative data was then transcribed and coded to identify key themes, and the quantitative data was analyzed in terms of median bother and median impact. So this table shows the ranked median bother for participants from RELAX and secondary care, where a bother score of 1 indicates highest patient bother. And as we can see that in both patient groups, urgency is regarded as very bothersome, but so are other symptoms like daytime frequency and urgency urinary incontinence. We also did a statistical test which showed statistical differences between the two groups for urgency urinary incontinence and nocturia. However, we might be inclined to think that the patients from the RELAX group would indicate greater symptom bother, but in fact, it was patients from secondary care that reported greater bother associated with urgency urinary incontinence and nocturia, as can be seen in the box plots. So this table shows the median impact scores for participants from RELAX and secondary care. And again, a VAS score of 100 indicates the greatest impact the patients can imagine. So again, we can see that urgency is quite impactful among the two groups, but so are some of the other symptoms. And again, we can see a statistical significant difference between the two patient groups for daytime frequency and urgency. But this is more in line with our expectations, and the impact associated with daytime frequency and urgency was higher in patients with, from the RELAX group than the secondary care patients, again, as seen in the box plots. So this slide shows a visual illustration of some of the themes and the sub-themes from the qualitative data analysis. And as you can appreciate, the interrelationship between the themes and sub-themes is quite complex, and due to time constraints, I won't be able to go into detail. But I have included some participant quotes to give an idea of the extent of bother and impact that is associated with the OAB syndrome. So in summary, the bother associated with each symptom is distinct and profound in its own right. And we've seen that urgency is, now we know that urgency is most bothersome and impactful, but so are some of the other symptoms like daytime frequency and urgency urinary incontinence. And patients have identified extensive coping strategies they employ to minimize bother of the symptoms, but these coping strategies also further contribute to the bother that is associated with the syndrome. And I feel that the bother impact and the wider issues associated with OAB should be accounted for in patient-reported outcome measures for overactive bladder. Thank you for listening.
Thank you. I think it's a very interesting study, and seeing from the point of view from the patient, it's small amount of patient per group. How many patients you plan to recruit at the end of the study?
So our study is complete because it was more qualitative in nature. Our purpose is to achieve theoretical saturation with qualitative data. So in total, we had 27 patients, and as I said, I couldn't go into detail to show the different themes and sub-themes, but yeah, that's more qualitative in nature, so it's more about getting some saturation.
Yes.
Adrian Wagg, Edmonton. Compared to the similar focus groups and work done for the preparation for the ICIQ modules, have you found anything different?
So what we have found is, so basically we've looked at symptom bother and impact, so how the bother and impact has affected them, but also some of the...
But have you found anything different? This seems to be a same stuff that was done all those years ago. Is there anything different? Have you compared?
I haven't looked at those data from the focus group, sorry.
Okay. I think we can, if there are no further questions, we can proceed to the following speakers. The following presenter will be Dr. Yoshimura. They will present the paper on comparison of inflammatory urinary markers in patients with intestinal